Hello everyone, and today we'll be talking about cervical spondylitis. Sorry, and we are very glad to have Dr. Yogita Madhyan with us today. And thank you for being with us.
Thank you.
And all my queries about cervical spondylitis will be answered by her. And my first query to her would be, what exactly is cervical spondylitis? How do you really define it?
So cervical spondylitis, it is a condition, where there is wear and tear of the bones of the neck. There can be wear and tear of the cartilages. There are degenerative changes that occur due to this wear and tear. So the degenerative changes that we see in the spine is the space in between the bones is reduced. Okay, and there can be slightly, a thickening of the bone. There can be bony outgrowths that can be seen in the spine, which are called as osteophytes. This generally occurs, above age 60 years of age. But nowadays we see it is very commonly seen in, young population also. Um,
So, when we know that this is cervical spondylitis, we also should understand the symptoms of cervical spondylitis. So, what really are the symptoms which are most commonly seen?
Patients who are suffering from cervical spondylitis, they generally come with pain in the neck. There is acute pain, there is stiffness in the neck, and in more severe cases, there can be compression of the nerve, which we call as radiculopathy, where the pain comes down. There can be tingling and numbness in the both the arms or one arm. There is stiffness in the neck. The movements of the neck are generally restricted. So these are, and in more severe cases, we also see headaches in some patients. So these are the symptoms which we see in the patients of cervical spondylitis.
Right. So now we understand the symptoms. So what really causes this cervical spondylitis?
In patients, we see that they are having, there is generally wear and tear of the cartilage that I've already mentioned, but there are repeated overuse of the muscles of the neck. The muscles of the neck are weak, or there are imbalances in the muscles. It is generally seen in young population because of sedentary lifestyle. We are sitting at one place for a long duration. We are working in front of computer. We are using arms in front of computer, and like while driving or long standing, poor posture, slouching. All these are the conditions, which aggravate, uh, this condition. So we should try to maintain a poor posture when we are working in front of the computer. Avoid any activity that aggravate this condition.
Mm-hmm. So, when patients come to you and you recognize that they have cervical spondylitis, what course of treatment do you suggest for them in general?
See, once a patient is suffering from cervical spondylitis, we have to first see whether the condition is acute, where the patient is in very severe pain, there are signs of inflammation, there is temperature of the part is raised, there is morning stiffness, nighttime pain. So such condition is called as acute, where I would advise patient to not use any of these things we call as harm, that is to avoid using heating, because generally in acute condition people are using heating pads and that is aggravating the condition all the more. To avoid using alcohol consumption, also to avoid using rigorous exercise. People think that if we exercise in acute pain, the pain might go away, but it further deteriorates the condition. Also massage should be effective. Instead, in acute condition, I feel the RICE regime should be followed, where the of rest from any activity that places stress on the neck should be avoided. Lying down would be very good, with a proper neck support, using a proper pillow, with a proper towel rolled under the nape of the neck, icing the affected area. This would help, to bring the symptoms down. So these are the things which we advise, and if the patient is coming with tingling, numbness, so accordingly we give them therapies like traction, mobilization of the spine, certain exercises which we demonstrate, and they need to continue doing this at home, also at workstation, which will help to keep the muscles of the neck active, and it will not affect the range of motion of the neck. So,
So, since you've said that workout should be restricted to some extent, so what what are things, what are exercises that a person needs to do, and what are exercises a person should avoid?
See, basically, heavy weight lifting should be avoided. The gymming should be avoided, but there are basic exercises of the neck. If a person is doing within pain-free range, it should not aggravate the pain, but it will help in improving the muscle strength. The simple exercises which I will be showing you will help in keeping the pain under control. So the exercises would be one simple exercises which can be done even while sitting is the chin tucks. You need to just take your chin backward, hold it, and then relax. This can be repeated 10 times every day. Second exercise is the shoulder blades. Patient needs to stand and take your hands at the back, hold it, and then relax. Third exercise is in sitting. Person is asked to rotate the neck from one side to the other. These are the simple exercises which can be even done at workstation. The fourth exercise is bending the neck one side and then the other side. And the last is sitting with the chair just half supporting the spine. Take your hand at the back of the neck and bend, go slightly backwards. Just extend your spine. Stay there for a few seconds. Relax. So these exercises, if it is done at workstation or every 2 to 3 hours, will help in maintaining the range of motion. Also, it will help to maintain the muscle strength and it will decrease the pain.
Right. But what are the lifestyle guidelines that one needs to follow, say for somebody who needs to prevent cervical spondylitis?
See, for prevention, once the cervical spondylitis has occurred, the changes, degenerative changes cannot be controlled, but we can prevent it from further deterioration by giving physiotherapy treatment, doing simple exercises, and following the advice that I gave. Poor posture should be avoided, slouching should be avoided. It is very important to drink lots of water and have a healthy lifestyle. So with these things, it will be beneficial to keep the cervical spondylitis under control or to prevent it from coming.
So I'd like to thank you for being so generous and being so educative about cervical spondylitis, and I thank you all for being here and watching this show. And please stay tuned to TO's Facebook, Twitter, LinkedIn, YouTube, and Insta pages for more such informative feeds, as we'll be back for more. Bye bye.
Thank you.